Hey, this is Dr. Darwin, the new dentist coach, with another episode of Ask Dr. Darwin. Actually, this episode is part of my educational series, and we're going to be talking about root canals, right? This is the third lecture and presentation in my educational series, Endodontic Education Series. And today's topic is Diagnosis Matters, how to become a root canal rock star. So you don't want to miss this. Stay tuned, okay? So guys, make sure, as all of these educational series, if you have questions, Dr. Scott will be answering questions. You can shoot him an email. We'll have it down below. You'll be able to see it. There also will be some time in the presentation for a break where you can ask some questions. If you don't get a chance to ask your question during the lecture, you can send me an email at newdentistcoach@gmail.com, newdentistcoach@gmail.com, and I'll get those questions forwarded over to Dr. Scott, and that way you guys can have a dialogue about some of the information that you have some questions about. So we're going to jump right into it. Again, the presentation is called Diagnosis Matters. And actually, let's just have Dr. Scott go ahead and get started.
Morning, everybody. I'm Dontra Scott, endodontist in Houston, Texas area. I'm going to present today a topic that's very important to me and should be very important to you as well. This topic is called Diagnosis Matters. All right. So I'm here to help you all become root canal rock stars in any way that I can. And one way that you're going to become a root canal rock star is starting with the basics. And the basics is that your diagnosis of the tooth actually matters. All right. We all have patients that come in the door with different complaints, different chief complaints, different issues, whether it be pain on cold, pain on biting, they've got swelling, they've got achiness. Some patients say, man, doc, it hurts all over. So our job is to determine what's going on and how we're going to address those issues. You are the front line, you're the dentist, and they're relying on you to solve their problem. So case selection is very important. That patient walks in the door, we're trying to figure out what's going on. So we have to have this kind of roadmap in our minds that we're going to follow. All right, you're always going to ask yourself, should I treat this patient? That's a very important question. But before you start treatment, you want to go through that checklist like I was just pointing out in your mind to come up with the correct diagnosis. So I'm going to help you set yourself up for success. All right, in order to do that, we're going to start off with your chief complaint of the patient. Medical history is very, very important. Sometimes that answers your question right away. You don't even have to go any further. Clinical exam is important. Then you're going to test that area out, your radiographic exam. Then we're going to go and figure out what is the diagnosis of the tooth, both the pulp and the periapical status, okay? And next will be the restorative prognosis of the tooth. You want to evaluate the periodontal situation of the tooth as well before you begin treatment. And then that's where you come up with your treatment plan. Patient walks in the door, it hurts, doc, it hurts. And they want to know, can we save this tooth, doc? So of course, you have to start off with the basics. Like I was saying, you want to examine the patient extraorally, see what's going on, any swellings, any asymmetries, anything that you can notice with your naked eye. Then you take it to the next level, which is the intraoral exam, all right? We want to start off looking at the soft tissue, the hard tissue, look at both the buccal aspects, as well as the palatal aspects of the teeth, or the lingual if you're talking about the mandibular area. And now, this may seem very obvious to you, but your tooth evaluation is very important. Patients come in with teeth coming in with different presentations, different clinical signs and symptoms. We want to evaluate the teeth and see what's going on in those areas. Are the teeth restorable? Do the teeth need post-incors after root canal treatment? As you see on the lower right there, is the tooth fractured? You know, are they having biting pain? It's something that's very important that I find nowadays is starting to get skipped a lot, is that medical history. You want to have an updated medical history to make sure you know exactly what's going on with your patients as far as medications, systemic illnesses, things that may affect your treatment and outcomes, and how you want to approach this case. The next slide I put up here is very important. After you go through your exam on the extraoral, intraoral exam, you want to do those clinical tests. Now, I know this sounds like dental school all over again, but these tests are very important in helping you determine the diagnosis of the tooth. Okay? Palpation of the hard and soft tissue, all right? You're checking for things that may be abnormal in the area. And then percussion. As Byers pointed out, the PDL is highly innervated with proprioceptive fibers. okay? So you're gonna have about an 89% chance of having an accurate diagnosis if there's periapical pain, and that was shown by McCarthy. So you wanna take the blunt end of that mirror, as you see on the upper right, and try to hit the inside edge of that tooth if you can, and see if you get a response, all right? Mobility is very important. Take 2 blunt instruments and see if you get any mobility, class 1, class 2. Is it periodontially involved? Is that sign of a fracture? This is very important steps that you want to take. And like I said, I know it seems very elementary, but these steps will help you get to that correct diagnosis that you're looking for, and then that treatment plan that will be acceptable. Probing goes back to the mobility area and the periodontal status. Let's check those probing depths. Is there an isolated pocket? Are there broad pockets? Let's figure out what's going on with this tooth and how sound it may be. And the last picture on the left there is the endo ice, okay? Endo ice is a very important step because it has been shown by Peterson to be about 90% accurate in determining what's going on inside of that tooth as far as the nerve goes, okay? So you want to take a nice, decent sized cotton pellet, larger size if possible, dry that buccal surface of the tooth off, place that ice on the tooth, and let's look for that response. Is it sharp? Is it quick? Is it lingering? Does it produce a throbbing, intense pain? Are there no response? These things will lead you in the direction that you need to go. The next question you want to ask yourself whenever you're coming up with your diagnosis and your case selection is, do you have radiographic evidence of disease? And are these radiographs diagnostic? The radiographs you need whenever you're assessing an endodontic case obviously are periapicals and bite wings. All right, you want periapicals that show you the whole tooth and even some millimeters below the bone if possible. And you need bite wings that are going to be diagnostic, showing you the level of the bone in relation to the tooth and the decay that may be present, any defective restorations, any signs of periodontal disease. These are very, very important things. Brinoff showed that it's very important to have at least 3 films to increase your accuracy of diagnosis up to about 87%. So that's usually a couple angled PAs and at least a bite wing. So remember, at least 3 radiographs.
Dr. Scott, so yeah. On that's something new. I didn't really realize that that's, you know, an important, I know, well, we all know that x-rays are, but to have the third one.
Yeah, the studies show that increases your diagnosis from about 70% to almost 90, 87% if you have that third diagnostic x-ray. Very important to get those 2 different angles on the PA and at least a real solid bite wing.
Cool.
All right, you are the doctor. All right, remember that. You're the doctor. The patient walking in the door to come see you to figure out what's going on with their area. So after you go through all your examination and your testing, you're gonna have to come up with that diagnosis. So here I've listed the diagnosis of both the pulp and the periapical status, all right? And I put the acronyms for those different diagnoses. You're gonna hear a lot of endodontists describe a tooth may have SIP, SAP, you know, stuff like that. So that's symptomatic irreversible pulpitis, meaning the patient's already walking in the door with pain, or you touch that tooth with endo ice and that pain lingers, you know? Or sometimes you take an x-ray on a regular exam and you see a large carious lesion. Patient has no pain, but you know if you go in there and try to fill that tooth or you try to put a crown on it, that most likely may expose the nerve or most likely get so close to where the remaining dentin level is so thin, the patient may have symptoms. So we call that asymptomatic irreversible pulpitis. And then the last one is if you go in there and you test with the endo ice, you get no response. The tooth may have a necrotic pulp, okay? Those are your pulpal diagnosis. And then you want to go to the periapical status. Is it symptomatic upon percussion? Is it asymptomatic, but you see a lesion on the x-ray? Or the periapical status may be normal, but the tooth just has a big cavity or it has a crack in it. So remember, you're the doctor and you want to come up with those diagnoses, the proper ones. Anybody have any questions or need me to explain those diagnoses again, I'll be more than happy to do so for you. Next question you want to ask yourself, which is a very important one. As the restorative dentist, can you restore the tooth? I get teeth all the time sent to me from general dentists, and they want to know, do I believe the tooth is restorable or not? What's the prognosis of restorability? I can always give my opinion on a tooth. And I often make a joke that I could do a root canal pretty much on anything. I could do a root canal on a root tip if you really want me to. But the question is, can you, the restorative dentist, restore the tooth? This image here is just something straight out of a textbook, and I like to pull this one up because sometimes we forget our basics. You know, we want to really evaluate that tooth periodontally, see where the carie level is, and how will our restoration fit into this model, because biologic width is very important after the root canal is done. You place that crown on, patient says, man, I'm still having pain upon biting. Maybe you're impinging on that biologic width with that coronal restoration. So like I said, go back to your basics, really evaluate that tooth for restorative prognosis along with perio. This is our plan. That's why I labeled this slide, because after we go through all of that and we come up with our diagnosis and we look at this tooth and we say, you know what, we can treat this tooth. We got to figure out exactly what we're going to do. So you want to consider, does the patient need pain relief through medication or any antibiotics if there's signs of systemic infection? Is this going to be a tooth that you're going to go through and do caries control, or maybe even temporize the tooth, you know, in the meantime? Is this a case where pulpotomy is needed? You know, maybe the anatomy is too difficult for you to negotiate the canal, so you want to do pulpotomy to relieve the stress of the patient. Those are different options that you want to consider in your treatment plan. Is this a tooth that needs a root canal from the endodontist? Do you need to refer the tooth out? Does the tooth need crown lengthening? Do you need to refer it out to the periodontist? These are things that you want to talk to the patient about, make sure they have an understanding and they have realistic expectations of the tooth and what the prognosis really is. And then lastly, your guys' favorite part, the coronal restoration. After you get that root canal done, you want to put that beautiful crown on there, but you want to make sure it's a crown that's going to actually seal the root canal system up. Because you can do the best root canal in the world, but if that crown isn't sealing it up, bacteria will get in and it's going to reinfect that root canal. All that work down the drain. So I put up a couple of different images here because this is going to just help you look at a tooth differently now. When you see that initial presentation, you did your exam, you go in and you look at those radiographs, you're going to be able to determine what's going on and what can be done. Is this a tooth that, like I said, needs a root canal, first of all, has a good restorative prognosis? Does periodontal involvement, does the periodontist need to get involved? And is this a case that you can handle? Do you feel like you can locate those canals and clean them out efficiently and effectively in order to have a good prognosis here? The tooth on the upper right there, you see the relation to the implant. Is this a tooth that we need to discuss the patient may need to lose? Or is this something that we want to try and, you know, hold on to? So different things affect different teeth. And then the one here on the bottom, the anterior teeth, you test it out, you look at it, you see the x-ray, you see that radiographic lesion there, but then you test it out and you get cold, you know, normal cold response. Maybe this tooth does not need root canal treatment. You got to go through and do all of your tests to make sure you get that proper diagnosis. It's your time to be a star. Together with all of the tests that we've listed, all the examinations, you can be successful at completing root canal treatment and your patients will love you for it. So just make sure you take the time, go through those steps, evaluate the tooth appropriately, and you're going to come out with the outcome that both you and your patient are looking for. If you guys have any questions, anything that you want me to go over, again, please contact me. My email is dscottdds@gmail.com. I'm also on Instagram at inyourmouth06. Email is probably the best way to contact me. But like I said, the diagnosis and the treatment planning, case selection is very important, especially from the general dentist aspect, because you want to make sure it's a tooth that you feel confident in, the diagnosis as well as the prognosis of your treatment. Thanks again, guys. And like I said, ask me any questions you have. I'm here to help.
Awesome. Awesome. Thanks, Dr. Scott. So I do have a couple comments, and it deals with your comment about the oh God, I forgot. It slipped my mind just that fast. The third X-ray, that was a good point. I think the diagnosis part, the pulpal and the apical.
Mm-hmm.
I know there's a reference. The AEE has a guideline,
Right.
that's used for diagnosis and also for treatment modalities. And I was wondering, when in your studies and things that you've done as far as becoming an endodontist, did you guys have like a cheat sheet that you used that kind of helped guide you through all the three different? I think there was a slide. I don't know if you can go back to it. There was a slide that had both the pulpal. Yeah, there you go. The diagnosis, the pulpal and the apical diagnosis, because I think at times it can get confusing, mm-hmm. diagnosis wise, especially if we're seeing the patient for the first time. And of course, you know, we'll be in the process of referring it to the endodontist. And I think what happens is sometimes some practitioners just may say, you know what, I don't do the endo, I'm just going to send it to the endodontist. And I think we kind of shortchange ourselves sometimes, but not also being involved in the diagnosis and being able to diagnose it properly.
Exactly.
So this SIP, this IP, in the no cold response. These three parts of each of the diagnosis for the pulp and for the apical, I think is key. So I was just wondering if there's some kind of if people contact you, can they get a little cheat sheet or just a one pager on what those three components are for each of the pulpal and the apical diagnosis are?
Yeah, definitely. You can definitely also find that on the American Association of Endodontists website. They kind of have like a flow chart, and a lot of textbooks also have like a flow chart for your diagnosis. And like I said, of course, I focus on that cold test because usually that's the one that's going to lead you in the direction that you want to go. Also, the patient's symptoms. You know, if they're coming in already in pain, then obviously it's a symptomatic tooth. You know, so yeah, the diagnosis can get a little tricky sometimes. But to go back to Dr. Hayes' point, it's a very important step in this whole process. And you, like I said, I titled this slide, "You Are the Doctor on Purpose," because you are the doctor. You have to come up with that initial diagnosis in order to make sure that we're even dealing with the tooth that needs root canal treatment to begin with. Because like he pointed out, I often get cases sometimes that the patient's having a pain in the area, but the doctor just put on a new coronal restoration. The coronal restoration has a slight overhang, food's getting caught in the margin,
Right.
and the patient's having pain, but it's not a nerve pain. It's actually a gingival issue. You know, so it's all about your diagnosis and taking the time to actually come up with the correct one. So yes, like I was saying, there are flow charts available on the AAE website, and a lot of your diagnostic textbooks will have also those flow charts available too. But yes, anybody can email me if you have any questions.
What's that email address again?
dscottdds@gmail.com.
dscottdds@gmail.com. We're going to put it down here, and so you guys can get that information from Dr. Scott, and you'll be able to ask some additional questions that you may have with regarding this. Trying to think, that's all I really have. Any other tips or pointers that you want to share with the group? Those
Yes,
that are listening.
as a general practitioner, what very important, like I said, you have to be confident in what you're seeing in the patient and what you're diagnosing in the patient, and you want to make sure that you're the first person to let the patient know about their treatment options and give them that realistic expectation and prognosis. You never want the specialist or another doctor who you send your patient to say something that, you know, for the first time, because then the patient is going to lose that confidence in your diagnostic ability. So just make sure you come up with a confident diagnosis, and these tests and steps that I've laid out for you would definitely help you do that.
Awesome. And I do have one additional question related to that. Question is, any updates, anything that has come out of the most recent AAE National Convention or Conference, any updates, anything that has that you have found that has that impacts general GPs or just doing root canals overall? Any new findings?
The most right now, a lot of things that are kind of being focused on are cracked teeth. I put that one slide up. So bite pain, biting on release, and then the prognosis of the cracked tooth. So if you notice a crown crack that you can actually visualize, you might want to initially try to do maybe like a coronal preparation and then maybe temporize the tooth, see how it responds to that temporization. If those symptoms don't go away, then we're going to have to initiate the root canal. And at that time, if you do see a crack, that's one that you definitely want to refer, because you want the endodontist to use his microscope to be able to see how involved that crack is. And then at that point, the endodontist, you as a general dentist, and the patient will have to come up with, you know, do they want to try to hold on to that tooth, or do we want to, you know, get it out and let's move in a different direction? So cracked teeth are a big thing right now. CT scans and their ability to detect the cracked teeth, that's another big area of, you know, investigation at this time. So like I said, just do those tests and let's go in the right directions together as a team.
Yeah, I know. In my training, we used to have a tooth sluice. Can't even say it, tongue tied today, but that was one that was very, very helpful. I don't know if people are still using those. I don't even know if, as an endodontist, what other tools are you guys using to help to determine if there's maybe a complete or even an incomplete fracture of the tooth or crack of the tooth?
Right, so that tooth sloop is very important. We also do a lot of transillumination, all right? Try to light that tooth up and see if we're going to get a bend in the light. Also, we do the methylene blue staining. The stain will allow us to see the crack very well, especially under that dental operating microscope. And then, like I was just bringing up a minute ago, the CT scans that are available now, they do have a way of detecting fractures in a lot of cases, but sometimes they're not able to detect it completely. So there are a lot of different ways that you can evaluate a tooth or crack, whether it be just in the coronal portion or if it is a crown root fracture or not. Also, back to that original examination, your periodontal probing also is very important to let you know maybe you've got a crack that's very involved, as well as those multiple angle radiographs will give you a lot of clues as well.
So with the periodontal probing, if there's an isolated probing, possibly that could be an indication that there's a fracture.
Yes, sir. Because you're losing that support apparatus around the tooth in that location. So yeah, that periodontal probing, like I said, in those angled X-rays will give you that kind of halo J-shaped lesion. That's a very key indicator that the tooth may be fractured. And then also clinically, if there's multiple sinus tracts around a tooth, that usually is a very pathognomonic sign of fracture.
Gotcha. All right, well, great. Let's see. Anything else in your slides that you wanted to show us?
No, that's all I have for today. So like I said, contact me with any other questions or concerns.
Cool. Let's go ahead and switch up real quick. And I want to thank Dr. Scott for coming on and being part of this Endo Educational Series. Again, guys, if you have questions, get in contact with him. I'll leave his email address down here. And for those of you that have any additional questions, you can ask him. And be sure to check out this next video right here as part of this Endo Educational Series. There's a couple here that I want you to check out as well. Dr. Scott, thanks so much. And we'll talk to you soon. Thanks.